What if getting the care you need didn't involve weeks of waiting, endless paperwork, and frustrating back and forth with insurance? This is Jonathan Kirsting with the Pittsburgh Technology Council and Tech 5 Radio, and on this episode of Healthcare Reinvented, I sit down with Dr. Timothy Law, Chief Medical Officer at Highmark, to explore how their new gold carding program is transforming healthcare delivery. By using technology and trust to remove unnecessary barriers, Highmark is helping thousands of doctors get patients the care they need, faster, smarter, and with a lot less stress. And this is more than an efficiency story. It's a patient-first innovation that could become a model for the entire healthcare system. If you keep on listening, you got 3 takeaways you're going to get today. First, how Highmark's gold carding program eliminates delays by empowering trusted physicians to bypass traditional prior authorizations. You're also going to learn why this initiative is dramatically cutting administrative costs and investing those savings back into patient care. You're also going to learn the powerful ripple effect that patients experience from faster cancer treatments to less anxiety waiting for test approvals. So if you care about the future of healthcare access, this is one conversation you just don't want to miss. So keep on listening now to learn how Highmark's gold carding program is redefining speed to care and why it's setting a new national standard. So let's welcome Dr. Law to Healthcare Reinvented. Dr. Law, so happy to have you here on Healthcare Reinvented. This is just the ultimate forum for us, the Tech Council, to be talking about some of the great work that's happening within Highmark, just to bring more care to more people, do it more efficiently. It's just this whole intersection of tech and with healthcare, everything in between. We get really excited. So welcome to the show today. So glad to have you here in the Huntington Bank Studios.
Oh, great to be here. It's a topic that I breathe every day. So glad to speak about it.
Then you're the right guy to talk to today.
For sure.
Send me the right person. I think that's fantastic.
That's good.
Before we jump into the conversation, though, I just love our listeners to get to learn about our experts. Tell me a little bit about yourself and, of course, what you do with Highmark.
Yeah, sure. So I'm a family physician by trade.
Okay.
I actually am a circuitous path to medicine. I started out as a veterinarian, then moved over into the human aspect of things. And I still have active practice doing house calls only for Amish and Mennonite people in Kentucky. But I work here in Pittsburgh, which is where I was born and raised. So I'm here every week. And I have been at Highmark since about 2018, was with one of the national plans for about 10 years prior to that. Here as the chief medical officer, really most of all the clinical facets of what you can imagine from the health insurance plan happen: medical policy, the medical reviews, the utilization management, the case management, the quality of aspects of how we're reviewing cases and how things happen here. Yeah, glad to be here to talk about that kind of stuff. And Highmark really is setting the edge on how that's done in the industry for sure.
Well, I'm super excited. First of all, your background's amazing. You're doing some really cool, diverse things.
Yes, for sure.
You're living your passion right now, which I think is just super cool. That is awesome. And today, of course, we're talking around this whole gold carding program, which I'm just fascinated with. And I guess was it earlier in June, there was this announcement about prior authorization by a trade group representing health insurers around the whole entire nation. Tell me more about the spirit of that announcement and what role did Highmark play within that? Because I think that got the whole ball rolling on this thing, right?
Yeah, I think really to understand it, you have to go back to the roots of the tech world part of medicine, right? And for about 30 years, I've been giving talks on telemedicine. When I was in the military, I did telemedicine from across the world. While I was in the university, I performed some telemedicine with the International Space Station. And so that techie part of how you can deliver the healthcare is just really near and dear to my heart. I've given talks on it from Belgium to Beijing. And before COVID, they used to pat me on the head like a little puppy and say, "Oh, that's really cute stuff, but it'll never take off." Then during COVID, they're all calling me and asking me like, "Hey, what was that device you used?"
Wow.
So within that thought process, whenever AHIP was getting together this Tiger team to say, how can we make people's access to care, that point in time where a doctor says, you need this, and the patient says, I want this, how can we make that next part of that process be seamless to them? Because really, what we're trying to do in this industry is, in spite of other people's thoughts, we're trying to be a conduit between the provider and the patient to appropriate care, not a roadblock. And so we don't want to be looked at this speed bump that you have to go over and jar your spine loose when driving down the road to just get where you're going to. We want to get you there seamlessly. And so because of that, I said, well, if you look at the next 4-way stop you get to in your car, And you think, do I really need a red light or a stop sign here? No, because you know what? 90% of the people are probably going to stop, slow down, and make sure it's safe. But there's that other small portion of the population that'll just slam on through. And that's really how I look at prior authorization. And so I said, well, if there's 80 or 90% of the doctors doing it right, then why are we bogging it down? Let's get out of their way. Let's say, hey, doc, as a reward for you always doing this correctly, why don't we say, you just tell us it's being done and we'll get out of the way, you do it. And so that's what we did. And we started looking across the industry. And for instance, Highmark has about 199,000 doctors in our network. If you look at it, though, we have only about 30,000, about 20, a little bit over 28,000 that actually write orders for the things that we're talking about, MRIs, CAT scans, and that kind of stuff. Of those 28, a little bit over 28,000 doctors, I was able to put 25,000 of them into the gold carding program now. Because, and so if you think the grand scheme of it, like it's mind blowing to think that we were getting in the way of 25,000 doctors' authorizations when in fact they were always getting told yes. It's like my kid coming and saying, do I have to go to bed at 9 tonight? Well, yeah, your bedtime's at 9. You don't have to keep asking, just go to. And so it's the same sort of thing we're trying to get through to them. Anyway, very passionate about it. AHIP was passionate about it. It brought the whole industry together, not just the Blues, but all the nationals, all the plans across the country, and said, how can we make this better for patients as well as for providers?
Wow. I mean, first off, I mean, you're blowing my mind once again with your past. I mean, you were doing the whole telemedicine thing when people were just saying that's very nice, when how
Yeah.
important that has become to
Yeah.
care. And then the idea of just your passion for being able to streamline care, how important that is for the patient to not have to wait, how important it is for your organization so that you don't have to worry, spend all this extra time and money and resources when you know it's going to be right 80% of the time, as you were
Yeah.
talking about.
You think about the money part you just mentioned. When I first got into this part of the industry back in 2008, it was somewhere between around $300 to just review one case. So your doctor asks for an MRI and then it goes to the health insurance company, whoever that is, between everyone touching it and how much it took, the faxes, the phone. And now it's under $20 probably because we're able
Right.
to use automation and
Right.
technology and
Yeah.
all this other stuff, portals, et cetera. So, yeah.
I just think about how you're able to reinvest that to do more work and provide more services for the patients. To me, it's just amazing.
Oh, for sure. You can imagine if you have cancer and you go to your doctor, right, and they want to get the next test if you need to check how your cancer's doing, and you can either A, go to the front desk and already have the authorization in your hand because it's already been approved because your doctor's gold carded, or you have this electronic authorization process, or you can go home and wait for 2 weeks and maybe keep calling back and forth and emailing to find out, am I going to get my next test for my cancer or do I have to wait? That kind of stuff. You talk about the worry that it takes off the patient. Forget about the cost that we can, put back into the market to do other
100%.
things and all this other stuff. But, just to get that worry off the patient's mind of like, is it going to be approved? Am I allowed to do this? Am I going to have to pay for it? All that kind of stuff is boom, gone before you even get down the end of the hallway.
That's just amazing. And that just makes me so excited I think about people, how many patients people are affected and how that just improves the quality of their lives. And I get excited because it helps you guys streamline and save money so you can use that to do more good work. I'm curious though, this makes sense that why Highmark would get behind this and say, well, we're going to do this program. Maybe explain to me how the program actually works. Just give me kind of the basics as to how this is going to kind of work and is set to do what it does.
Yeah, sure. So once we find those doctors, and we have a very intricate process, we go through them. We look at their past experience and how they got their approvals, et cetera. And then once they're in the program, instead of so if they're ordering, say, an MRI of someone's shoulder, normally the front desk staff or someone that does their orders for them would have to put in their the name, rank, and serial number of the person, so you get all that kind of information, and then also all the clinical information. Maybe it's a page, maybe it's 30 page, maybe it's filling out an attestation. Or if they're gold carded, all they have to do is put in the name, rank, and serial number, and then put right shoulder, MRI, enter, boom, the authorization number flashes up on the screen. No more of the other stuff. And so that alone, because what happens is if they're not gold carded, they would put the clinical information in. It would go through the portal, hopefully. In the old days, it was the fax. In the old days, it was the phone. And in the old days, it was a piece of mail. And
My goodness.
exactly. And so now, they put it through this portal and their clinical would come in. A nurse would look at the clinical based on what the diagnosis and what the procedure is. They would say, yes, that meets the medical policy. That could take them 20 or 30 minutes to do that. If it doesn't meet the policy, then they would have to put it in another piece of the electronic record and send it over to one of our doctors who then look at it, compare it to the medical policy and say, oh, I see where it doesn't meet, but let me read the clinical behind it and see if I can get into the mind of the doctor that wrote it just based on his or her words and come up with the same idea to see if this could meet criteria or not. And so that could take For instance, about 4 years ago here at Highmark, our turnaround time for that specific scenario I mentioned was about 12 days. About 2 years ago, we got it down to 4 days.
Okay.
As of the end of September of this year, so right up within 2 days of now, we
Yeah.
got this data. We're at 0.76 days. It's about 14 hours for the average turnaround time for anything that comes into us. And we have
Oh
about
my.
50% of our authorizations. We get about 3 to 400,000 authorization requests a month. And about 50% of those are at the point of care determined or on the spot. So before you walk down the
Wow.
hallway. And it's just huge. Our goal is to get up closer to 90, 95%. But we've gone from 26% about a year and a half ago to almost 50% now. So we're well on the path for sure.
Those are just staggering numbers. Like literally my jaw is dropping as you're
Yeah, it,
telling me
it is
this
staggering.
because
It really is.
wow, this is like a massive change. This
Yeah.
is fundamentally changing how fast people can access the care that they need. Simple
Yeah.
as that. I mean,
Yeah.
I can't think of anything cooler than that.
The other thing about this gold carding is, there are some states that mandate it. And when they mandate it, they say, okay, if the doctor's at 80%, we'll put them in gold carding. And when I looked at that, I said, wait a minute, 80%, that means 20% of the time they're having inappropriate tests ordered. An
Okay.
inappropriate test could mean exposure to radiation. It could mean exposure to new tests that if you
Okay.
find something on that one, you got to chase your tail. And so I say, are we willing to accept a 20% waste in the system to do
Right.
this? And they're like, well, you can't do it any other way because you can't expect that much of doctors. And I was like, no. As a doctor, I think you should expect perfection, right? You're not going to bull a 300 game every time, but you ought to be getting close if you're on the tour. So we actually put our number at 99%. And I already told you before, we have 25,000 out of the possible 28,000 doctors
Right.
gold carded, and they reached it. Because what we do is we say, hey, doc, you're close. You're not quite at 99. You're at 94, 95. We can assign you, we do what's called active gold carding. So we can assign you a concierge nurse from our company that will help your front desk staff get the orders put into the computer to make sure it's right. Because we found out that about 60% of our denials were due to clerical errors on the side of the physician's office. So
Really?
maybe,
Oh
for
my.
instance, if you're doing some imaging studies, you have to do some with contrast and some without. But
Okay.
sometimes the person at the front desk doesn't know if the doctor wants with or without. So you know what they do? They order both with and without. So we end up denying it because you don't want them
You
both
can't do
ways.
both. Right.
So instead of they might get one approval for the without and one denial for the with. And so it looks like they only got 50% of their things right. Well, then we looked at that and we said, let's marry these together. Let's not get duplicates. Let's get all this stuff out of the system and let's show your staff how best to hit the right radio button for what you're actually asking for. And you get all that waste out of the system. And when we did that, all of a sudden, all these doctors were coming up close to 90%, 99%.
Wow, that
Yeah.
is interesting. So I'm also looking at this just from the doctor's perspective. I can only imagine how busy doctors are. You know this firsthand. You're a physician.
Yeah.
And the idea that having this status means that they don't have to be second guessed, but they're being trusted more to know that they're doing what they're doing and that it's the right thing and that they know they're doing right by their patients. So they don't have to go and do all this back and forth. It just seems like the doctor should be really stoked about this for saving themselves time and not having
Yeah.
to go back and redo an authorization and submit it again and everything like
Right.
that.
I look at it like being a parent. You don't want to be questioned
Okay.
on your decision, right? No one wants to be questioned on why your kid has to
Right.
go to bed at 9. If your kid starts questioning you, like, okay, now what's going on? Well, same thing with the doctor. You don't want to be questioned on why you're ordering something for somebody, especially when you never got it wrong to begin with. So let's just get
Right.
out of your way. And so what will really help this industry though is what we're doing now with AHIP and with Blue Cross Blue Shield Association is trying to come up with some sort of national quote gold carding. They may call it something different than that, but some kind of provider recognition program to where if I'm in my office and I'm in Pittsburgh and I have 30 patients a day and 40% of them are Highmark, they're gold carded. But what about the other 70% that's
Okay.
from other insurance companies? Well, no matter who it is, if they don't have a gold carding program, then I still have to operate a staff that does all that thing you mentioned earlier, which was chasing this, answering this, explaining that. And so if we could get something going where the whole community on the health plan side put something together so that doctors can say, they can put a shingle out, say, and also I'm gold carded. So you don't have to worry about not getting what we need done for you kind of thing. And I think that's will be the next level up of what
That
we
makes
want to do here.
sense.
Yeah.
Yeah, that makes total sense. I just love seeing these results so far.
Yeah.
This
Yeah.
has only been going on for so long now, which I think is just absolutely Amazing. What are some of the benefits you've been seeing so far? I mean, I think we've kind of stated the obvious that people are getting the care they need
Yeah.
faster. What else are we seeing out there?
I mean, we're seeing the things like the expense on the doctor side, of course, as you mentioned earlier, going down. We had one doctor tell us, I'm going to read his quote here. He says, I
Sure.
highly recommend Highmark's gold carding program to any practice looking to improve its workflow, reduce administrative burden, and enhance the patient experience. It's a win-win for both providers and patients. Boom. And that's
There you go.
that's someone from our New York market, one
Yeah.
of the docs up
Okay.
there. Yeah.
Wow. As you bring more folks into the process, you have to make sure that they stay at that level, right? So is there a system that's in place that always makes
Yeah.
sure that they're doing the right things, that the numbers are lining up, they're seeing the results
Yeah.
that you want to see?
Yeah, good thought. Great question. We do a couple of things. One is
Okay.
we look at what their utilization was before. So, say we look at their past experience or last year, they've ordered 100 of that test. So, we put that particular doctor with that code on a graph and we say plus or minus whatever percent we look at. We put a line above and below and see if their utilization ever is like, playing the old operation game. If it hits that thing, it buzzes and tells us, you better take a look at this one.
Right.
So, that's one thing we do. If we see utilization change, we look into it. The other thing we do is we have a robust auditing program. So we have, based on statistics and all that kind of stuff, a certain amount of cases that are automatically audited each month. And so we have an auditing team that goes through and look. Now, mind you, this doesn't delay care or anything because the care's already been done, which is
Okay.
the way it should be.
Right.
No one has to worry about whether their stuff was getting done or paid for. It's already been completed and paid for. But we're looking to say, hey, if we had put this through the other process, that rigorous process early on, would it have been approved anyway? And when we started this process out last year, we had maybe, 3 to 5 a month we had to push back on. So far this year, knock on wood, since January, we've had 0 doctors we've had to remove from the program for any
Okay.
kind of thing like that. So our audits are across the board, pushing through. The docs are staying above board with it. It's really been very successful on both sides of the fence.
0. I mean, come
Yeah.
on.
Yeah,
That's
yeah.
that's
It's just
pretty amazing. Like,
it's
wow.
yeah, we say externally, people are loving this gold carding. Internally, people are like, how could it be 0? And so we're showing these audit
Yeah.
results. We've actually gotten external counsel to come in and do an audit of our audit process to make sure we're
Right.
just kind of validate and validate and validate over again because, the industry is what it is. And so you have to still make sure you're keeping safe to the fiduciary responsibilities you have to your
course.
company, all that kind of stuff. And also making sure patients are still getting the appropriate care
Right.
that you're so ethically bound to make sure of. And so far, so good. So that's excellent.
Yeah. How long do you expect to take this other percentage of doctors that are not gold carded to get them into that status?
Yeah, I think that's the next strategic initiative we'll look at.
Okay.
Will this be, are they close enough to do some coaching to bring them up? Are they willing to be coached to bring up? Because
Sure.
not everyone's an NFL football player, right? You can only take the ones that can be coached, as well as should they still remain in your market? And so there's always this network optimization to make sure you have the best doctors in your network taking care of your patients because you want the best doctors taking care of your patients for the best outcomes. And yeah, we'll see how far we can push it. So far, this 25,000 out of 28,000 has been just disbelief across the industry is saying that we can get that many in
Yeah.
there. Yeah. So I'll see how far we can get. A willing doctor and a willing practice, we can get them there. If they're unwilling, you can't make a horse drink, you leave them to water kind of thing.
Absolutely. But I mean, obviously, just the fact that you're at 25,000 now is like mind numbing. And then you're reporting no one's falling off that number, which is really
Yeah.
and you actually brought in outside auditing to prove that our auditing is giving us the
Exactly,
proper
right.
number.
Yeah.
It's pretty amazing.
For
Like, I
sure.
don't know. But I mean, it seems like this has been a really just very positive thing, but there's always gonna be some sort of challenges along the way. Have there been some challenges or misconceptions maybe that you've
Sure.
had to like kind of cut through a little bit?
Yeah, I think so. On the provider side, I think some of the early challenges, and still every
Yeah.
once in a while to this day, a doc says, "What do you mean I still got to enter it in the computer?"
Hmm.
We're not clairvoyant, so we can't imagine that you're going to order this. Like you have to tell us. But the other thing that they don't understand, and this is what helps them understand, on this side of the ledger, on the health plan side, when we get an order for an authorization for whatever, it stimulates other parts of that member's benefit package. So, say your grandmother needs a hip replacement. If we didn't ask for the authorization prior to surgery, we wouldn't know it ever happened until the bill came in 30 days later. Well, if we know ahead of time, we know that, oh, part of her benefits are we can take meals to her twice a day for 14 days after this surgery. Did you know that? Oh no, how would I know? Well,
Wow.
you wouldn't, but
Okay.
now our case managers know to give her a call and say, hey, do you have someone at home to help you? Do you need PT at the
Right.
house? Do you need a nurse at the house? So it triggers all these other benefits, which in the past, if it wasn't on a prior auth list, you would never know that until after the fact. And so that
Gotcha.
alone has helped bring doctors along the continuum of, okay, I'll still put it in, but I just don't have to put all that clinical in, and I don't have to worry about doing a peer-to-peer and appeal and all that kind of stuff because it's going to be approved.
Yeah. So I'm curious. I just feel like you could be scaling this out to like other specialties and more procedures. Is that
Yeah,
something that
we
you guys are
have.
thinking about?
Yeah, so we started out with 6 modalities 2.5 years ago, give or take. We had about 400 doctors in the program back then, and we're now up to 19 modalities with about 600 and some codes on it. And we are always open. We tell our docs and our health systems, we're always open to suggestions. So when someone calls us and say, "Hey, what about this post-acute care at the skilled nursing facility? Can you gold card that?" Which is something we're looking at right now. We're like, you know what? That's a great idea. So let's get together with the providers, tell us what your pain point is, so we know ahead of time what the real question is. Then I get my team, I have a great team, a gold carding team that really digs deep into it and say, is there any way we could put this on the gold carding program too? So we are always open to suggestions from both patients. One of the great things about Highmark is they're so forward thinking and willing to take that next step to make the customer experience really what it should be. Like
Mhm.
when you're sick, you don't want to be sick, and you want to be able to put all your energy towards healing, not towards fighting with your insurance company or doctor to
Right.
get something done. And
Right.
so that's my mantra every day to my team. Well, in this case, a patient with the lung cancer, after their treatment, they generally get these things called PET scans. It's a specialized type of scan of their lung or body or whatever, and it's predetermined that after a specific type of lung cancer, you'll get one every 3 months for a year, and then one every 6 months for a year, and then once a year for 3 years. So you'll know that you're at some point you're going to need 6 PET scans. Well, the way it currently works is every 3 months or 6 months, whenever it's time, the doctor will order another scan. And invariably, they get denied because, oh, you're 2 weeks early. It's not quite 3 months, or oh, this or that. And so, had a patient say, if you know I'm going to get them and you trust that my doctor's a good doctor, why not just give them the approval for all 6 at the beginning?
Right.
And so we're looking into doing, and we're doing these now, these bundled authorizations. We're like, this is your diagnosis. We know you're going to need up to this. We'll give them to you. If your doctor wants to do it at 2.5 months instead of 3, that's on him or her. If they,
Exactly.
at the 6 month, if they need more than that, then they can come back to us and say, hey, something else went wrong. I need an extra one. And then we could look at it. But if you don't, then you don't have to, as a cancer patient, wonder, oh my goodness, am I going to get my PET scan on time? What if it's growing in here and I don't know anything about it? And now the
Yeah.
insurance company's making me wait 2 more weeks and I could already know the answer. Nobody wants to put up with that. That's
At
that's
all.
that's a
Yeah.
conduct unbecoming for a patient. They should be concentrating on healing, not concentrating on what we're doing.
I love two things about this story. I love the fact that you're actually getting feedback from people that are experiencing the need and they're able to bring their feedback and
Yeah.
you can actually react on that and make that something that happens. That to me is just so freaking cool to be able to do that because then you're only going to make the system better.
Oh, for
And
sure.
then the idea then that you can then say, yeah, we know that as part of this thing, you're going to need 6 of these. So at least 6 are going to be approved now. So use them when you want. And if you need more, then you go for the authorization. Then you don't have to worry. It's one less thing someone's going to have to worry about and fight about. And they can know something that's going to make them feel better or get them
Exactly.
different care as needed
Yeah.
that much faster.
Yeah.
Wow.
That's
That,
one of the great things about, Highmark is this blended health organization where we're really closely tied with the providers. So we also include providers from the systems out there, not people that work for Highmark, just people, independent physicians that sit on our medical policy team and sit on these strategy teams to say, hey, I think this might help, or hey, this would be a way to word that. And
Mhm.
here's the documents or the papers that are out there to prove it. And so we help them change our medical policy and do that kind of stuff. So if you're not involving all 3 entities, the provider and us, then someone's getting left out in the cold. And really no one in that continuum should be left out in the cold because they're all as important as each other. So that's kind of how we've been approaching it.
Yeah.
And as a physician, for me, it really wets my whistle of, being a doctor first and providing care to people, no matter if
100%.
no matter if I'm the one seeing the patient or the one, coming up with the policy on this side.
Yeah, absolutely. I mean, of course, you guys are tracking your metrics on this stuff. That's what you got to do so you can continue to improve. How will you actually measure success over time? There's different factors, of course, but like, more just from how fast someone gets care to whether,
Yeah.
they survive something, money that's saved. How do you measure
All,
success? There's, I guess, many
all,
metrics, I suppose.
yes, all the above. So one of the things that AHIP put together, you mentioned in June with the commitments from all the CEOs from all the different
Yeah.
companies, was that we would be more transparent, that we would be quicker, that we would get out of the way and less roadblocking, all that kind of stuff. So one of the things we're watching is time. How fast does something get turned around? And like I mentioned those numbers earlier. We're also on the gold carding side. We're watching what kind of costs we're saving. So we put out data to our providers to say this is how much and how much time and how much cost you used to put into this authorization. But now that you don't have to pull your doctor from seeing patients to do a peer-to-peer on the phone, which is a phone call between two doctors to discuss the case or an appeal, you've cut your cost from $32 per case down to 16 or 11. So we print that out. We do it from our side on the cost of how much it costs us to do an auth, how much we don't have to do because there's no appeals to go with that. We're looking at the data, of course, from our auditing process, which right now is at 100%. So we're good. I don't want to jinx myself, knock on wood, but we're at 100% there. But those are all the kind of things we're tracking, as well as we don't want it to get stale. To your point earlier, like we're looking at what else can we add to the gold carding? What other procedure out there that we're doing on prior auth could we put to gold carding? And how can we expand this across the networks to not just include our docs, but how can we do it if one of our members is out of state visiting in, say, Iowa, and they have to have something done? Can we also find out a way to help Iowa kind of honor our stuff and go that way? So that's what we're working on now at the Blue Cross Blue Shield Association level.
Yeah, it just seems obvious that as people see the results of this and they see how powerful this is, that this can really become a model for every payer. I want to see you guys all get on that same page. That way, then if you're going across, that if they do it into another network, it's
Yeah,
good.
it's key to make it work. We need to do something in the United States to, when the people talk about the rank of healthcare systems in the world
Yeah.
and they talk about United, it's not the healthcare that's bad, it's the system that's been broken. So
Right
this will
action
help
and
the
stuff.
system correct itself and make the experience, what it should be for a patient and for a provider as well.
Awesome. I'll tell you, Dr. Law, this has just been a fascinating conversation. This is just these things like they get me really excited because
Me too.
first off, I see a place like Highmark really taking lead in this. And you guys are in Pittsburgh that makes the
Yeah.
Pittsburgh Tech Council quite proud. And we know how important awesome benefits are to all of our member companies here. These are the companies that are building Pittsburgh. They need men and women to be happy, healthy individuals, and they rely on these types of benefits to make that happen. It's such a crucial part of what makes our ecosystem tick. And to see this happening to me just gets me really fired up, as you can see. And I'm just excited to continue to see more doctors reach that full 29,000 number and just see more modalities added to this as well, too, because it really seems to be working. And you must be really stoked to have played a role in watching this kind of all come together.
Oh, for sure. It's one of the highlights of my time at Highmark, and really not possible without the patients
Yeah.
cooperation, without the providers really leaning into this and accepting it and helping us make it as good as it could be.
Yeah, can't thank you enough for your time. Just, I know you're a super busy guy, man. You've got a lot going on, but I really appreciate taking the time to talk to us here on Healthcare Reinvented. These are the conversations we love having because we gotta let everybody know there's some great stuff happening when it comes to the intersection of technology and healthcare and what healthcare is doing to get more care to patients. Great stuff, Dr. Law.
Yeah,
Appreciate you.
thank you so much. Yeah, I appreciate it as well. Thanks so much.
Hey, everybody. Thanks again for listening to Healthcare Reinvented. We will catch you on the next one.